So a lot of people who are looking for straighter teeth or maybe an overbite are considering Invisalign. It's quite popular, but there's a lot of questions about that. Who's the right candidate? How long does it take? What does it do? And here to discuss that today is with Dr. Pashmini. Welcome.
Thank you so much.
Sure. So Invisalign, what could you tell people who are considering it? Who's the right candidate? What is involved? What do they need to know?
Of course. So Invisalign is basically invisible aligner therapy. We call it also clear aligner therapies. It's an alternative to braces. So patients, most patients, when they think of orthodontic treatment, they're thinking braces, brackets, this headgear that I'm used to when I was growing up. But we have come a long way from that. And Invisalign is a patented technology that they started in, I believe, late 90s when they came up with this clear aligner technology to move teeth just using plastic. Their plastic has patented all these technologies in it that basically puts pressure on the teeth and moves the teeth, and it works very well. Over the last 20 years, they've come a long way, and these days we can pretty much correct any malocclusion that you can correct with braces. We can also correct it with Invisalign. Invisalign is suitable for adults who don't like the way their teeth look. It's very good for fixing the bite. When the bite is not even, I always compare it to when an 18-wheeler has one wheel out of alignment and it's pulling to one side and it's wearing the tires unevenly. But once you need to align that tire, you need to put the teeth in the right position, and then you'll get much more long-lasting restorations in your mouth. The teeth will last much longer. Invisalign is usually it takes about a year to a year and a half from start to finish. Most patients are great candidates for it. There are very few situations where I would recommend braces over Invisalign. Compliance is a big factor. So there are patients who cannot tolerate wearing the aligners all day long. Those ones, yeah, you're better off with braces, because if you're not wearing them, they're not going to be working. But most adults are compliant, and most adults understand the basics behind tooth movement. You need to wear it for the teeth to move. And as long as you're compliant, the Invisalign will correct a lot of different problems. Deep bite, spacing, crowding, uneven smile, uneven midlines, anything that patients don't like, we can usually correct with orthodontics.
Well, sounds like Invisalign can obviously treat a lot of different situations, and it's nice. Having braces twice myself growing up, I can relate to the challenges with the wires and everything, so I wish that was around when I was younger, but very insightful.
A lot of our patients are adults who went through braces a couple times during their lifetime, and then for some reason they lost track of wearing retainers, or they lost the retainer, and then the teeth shift. Teeth have memory, so they like to go right back where they were. And now we look at them and they're like, well, I've had braces before. I didn't realize I was a good candidate for Invisalign too. I'm like, absolutely. If the teeth need to be aligned, Invisalign is your best option.
Got it.
It gives you the freedom to eat what you want, drink what you want. You're not really limited but for your diet, and it's not really cutting the inside of your cheeks and lips. So it's very beneficial for patients. Yeah.
Great. Well, for folks who didn't know that before, hopefully this podcast has given them the insight to say, might want to look into Invisalign. So great. Very helpful. Hope everybody who's considering Invisalign or a straighter smile considers talking with Dr. Pashmini. So appreciate your time. Very helpful. And we'll talk again soon. Thanks for your time.
You're welcome. Have a good day.